Hello, everyone. First of all, I want to thank the organizers for making this amazing mixing ideas, people, and results. And thank you for attending this session. And today I'm going to present the results of a pilot study. I've been a scholar for the Foundation Knowledge Exchange. So I started to study the effect of switching from smoking to other alternative of non-combustible tobacco products on oral health. And you don't know, but I'm a dentist also. I'm teaching, but I'm also a dentist. So from a dentist point of view, you can find out what are my results. So everybody knows that smoking is a problem of public health worldwide. Sorry. But from so many years, the dentists were involved in this tobacco treatment, tobacco staining out, tobacco treatment, I mean not tobacco treatment, but scaling, cleaning the tobacco user teeth. So now everybody knows that if we, no, sorry. Sorry. Okay, thank you. I started the study just because when I read about every studies published, everything was about lung problems, lung disease caused by smoking, also liver disease, cardiovascular disease, as you know, so many other problems. So I said the first impact when somebody is smoking is on oral health. So the first impact, the first contact also with the product is on oral cavity. So that's why I decided to study these oral changes, if they are. The results shows they are. And I will pass all the slides about what kind of disease can be caused by smoking, like odontal disease, periodontal disease, and some other disease that you can even see yourself in the mirror every morning. I mean, a very ugly tongue, or oral candidosis, or nicotinic stomatitis. I mean, something that is change in your mouth. I mean, not your mouth especially, but in the user of tobacco mouth. So I'm not speaking about halitosis also, that everybody can observe and feel if you are speaking with a smoker. But this is what kind of tongue a smoker can have. So what I did, I recruited 20 subjects who have expressed their interest on quitting smoking. They have answered a brief questionnaire about what kind of alternative methods that they can use for quitting. I explained to all my patients the advantages and disadvantages of using several products like pills, snus, heat-not-burn, vapes, and others. And most of patients have made their choices in using heat-not-burn. In Romania, it was very popular and fashionable to have an IQOS. And when I started to ask them what kind of alternative do you want to use, they said, oh, I would like to try an IQOS. Okay. After that, I left them for 2 weeks to decide whether they will continue using heat-not-burn or they will return to smoke a normal cigarettes, because this is something very challenging. Everybody wants to try something, but for a study, we have to be sure that they will continue, at least for the period of the study, to use only the heat-not-burn product or another alternative product that they will choose. So after that, I divided the subjects into groups, 15 that will switch to IQOS, and 5 subjects as a control group. I followed some inclusion criteria and some exclusion one. All subjects have signed documents, data protection, patient consent to medical research, patient consent to taking oral pictures in medical unit, informal consent. I mean, all the documents that you have to fill before you start clinical research. And I did this clinical trial. I made the diagnosis, and I made a cleaning, a scaling, a route planning just to have a zero moment for everyone. I mean, I was thinking that if we have to compare some data, we have to start from a 0 point. So we cannot leave everybody to have his own choice. So it must be a repairable moment. After that, I made some pictures, because normally the images are speaking for themselves. So everybody can see, and I'm very sure that every one of you has made scaling ones. So you can always take a look of how they are looking. Your teeth, I mean, you can observe even if you are not a doctor or a dentist. So I make a reevaluation at 6 months and 9 months, and also with photography and questionnaire. So today I'm going to show you what kind of results I found. So you can see some picture showing how it looks at teeth, I mean some teeth of a smoker first visit, a smoker after the cleaning, and after 6 months of switching. So you can find a very slight dimension of a calculus, I mean the bacterial plaque. We all know that the bacterial plaque is related with a lot of disease. And it's also related with the gingival disease, the oral mucosal disease, and it can start from the bacterial plaque. We can start over with cardiovascular disease and many other diseases. Another case, you can see the same kind of evaluation. A smoker, first visit, you can see the amount of the calculus, the bacterial plaque, and how it looks after 6 months. I want to tell you that every patient was instructed for a good oral hygiene, and every 3 months he came to reevaluate this kind of instructions, because it's very important that they will keep the same style of cleaning even at house. It's not something that you can change it like you want. Another case, you can also see it after 6 months of switching. The amount is less. And another one, this case, it's with the smokers. This image, the first one, it's the first visit before cleaning. The other one, the first visit after cleaning. And this person, it's the person who continue smoking. So this amount of the bacterial plaque is exactly after 6 months of not switching. I mean, a cigarette smoker who continues smoking, and he didn't want to change. I mean, I took some comparison with the other one. And this is the conclusion after 6 months, how it looks. Somebody's teeth who are switching after 6 months, and somebody's teeth who are not switching, and he smokes all over again. I mean, he's not stopping anything. Oh, sorry, I don't know what's happening here. But here you can see the difference a little. It's a problem with the slide, I think. Okay, but you can understand now. Here it's with the switching, and the other one, it's a smoker, a regular smoker. After 9 months, because I told you I made a reevaluation after 6 months and after 9 months, at the initial visit we have one image and another one after 9 months visit for a non-smoker, because I told you I have a control group with non-smoker person. And this is for a smoker. I'm sorry, the image is not so clear. I will show you some others. And somebody who's switching, it's another angle, because usually to use the same angle to make a photo when you want to show something in oral cavity doesn't mean, if you have the same angle, doesn't mean that you show exactly what's happening, because some subjects and some patients are not using all the time all part of their mouth to masticate, and that's why the amount can be different. So that's why I took another angle for this picture, for this patient. Also, after 9 months of switching, you can see the amount of the bacterial plaque and calculus. I mean, here also. After switching, you can see the difference. I cannot explain to you much more than this because the images are speaking for themselves. And also, this is a comparison between a non-smoker after 9 months, a smoker, and a person who switched the cigarettes with non-combustible heat-not-burn products. So what I saw, I will not read the slide, because what I finally conclude that normally, if you are making this switching, I mean, if you try to switch and you continue using the heat-not-burn product, you will have less tartar, less calculus, and less bacterial plaque. And even if you have an amount of them, it's much easier to remove. So you can imagine yourself, how is it to remove a very big amount of bacterial plaque, and the dentist will use a scaler, and how is your comfort if the dentist will use a brush, a rotative brush? It's something unbelievable different. So I think all the subjects can come to the dentist without having this fear that it's going to hurt them, and it's going to be some ruined day coming to a dentist. So from my point of view, from a dentist point of view, I think using that kind of products can minimize the amount of the calculus and bacterial plaque. So the patient can come more relaxed to the the dentist office. And plus, I would like to tell you that usually the dentists are not making tobacco harm reduction. The only moment when the dentist specifically speaks with, are specifically speaking with the patients about cessation, it's when they make an implant treatment. Because during the osseointegration of the implant, we have to stop smoking, or at least minimize the number of cigarettes. The blood vessels from the bone, they are stopping the osseointegration. That makes very difficult the osseointegration. So this is the only moment when the dentists are saying, please don't smoke, at least for minimum 3 months when the osseointegration must be made. So I hope it's something interesting for you to see. It was a very small pilot study. So I look forward to make some other studies in a larger number of subjects. So statistically, we can tell you after that exactly if we can find regularly the same results as I found now. And I spoke with all of my colleagues about this project, and they told me it's very interesting, we will do it, we will speak with our subjects to start something in tobacco harm reduction, which I think it's a very good point. And I will leave you with this image with 3 geniuses, and I will let you think to put the healthy life as a priority, as your most important thing, because sometimes we are putting the most important thing in some other direction. Thank you very much.